Ladies and gentlemen, please welcome to the stage Prep Summit co-chair Dr. Oscar Allen, Senior Advisor of Programs, National Association of County and City Health Officials.
This morning we'll be hearing a lot about cybersecurity. And I understand that sometimes, especially in the preparedness world, folks may think, well, that has nothing to do with me, that's that tech, that's that IT stuff. But understand, the work that we do, the tools that we use, and the resources that we rely upon all dovetail into the impacts that cyber has on our lives. And that's why it's important for us to have this particular session. We have structured the session to be highly interactive with you, the audience. So get out your phones and be prepared to participate. Our moderator for today's session is Steve Curran. Steve served as Director of the Division of Resilience within the HHS Office of the Assistant Secretary for Preparedness and Response, ASPR. This division houses the department's continuity of operations and critical infrastructure protection programs. Their mission is to sustain essential functions of the nation's healthcare and public health system by collaborating with government and private stakeholders and sector partners to prepare and overcome disruptions together. Steve has focused much of his recent work on preparing for the healthcare infrastructure impacts of cyber attacks. He led the department's establishment and support of the healthcare industry cybersecurity task force, which reported to Congress last year on the state of cybersecurity in the healthcare and public health sector and what can be done to improve it. He also served as task force lead for the HHS response to the 2017 WannaCry and NotPetya ransomware campaigns. Prior to joining ASPR in 2008, Steve served as Senior Director for Public Health Preparedness at the Association of State and Territorial Health Officials. Please join me in welcoming to the stage Steve Curran.
Thank you very much. I appreciate that. Good morning, everyone. Thank you for the introduction and for the kind welcome. I do want to let everyone in on a little secret before the rest of the panelists come on stage. And I hate to say this, but I'm gonna let you in on a secret. For this session today, we've got about an hour and a half to talk together. You don't need to listen to any of it because you, all of you, are proud inhabitants of the 21st century. And what that means is that each one of you owns one of these. And while we're talking up here today, you can certainly check into your flight, check your bank account. You can even shoot little cartoon birds at a bunch of pigs. Whatever you need to do, you can do on your phone. Also, in this day and age, you could schedule an appointment with your doctor. You could look up when you had your last appointment, what was your blood pressure reading? You can find that in your electronic health record. You can order a refill of your prescriptions right here on your phone. So much of our healthcare today is enabled by our technology. We can do so much because of the technology that's available to us to improve care for patients, to keep the public healthy. And it's a great thing. But also that capability that the technology gives us also leaves us open to vulnerabilities. And that's why cybersecurity, cyber attacks, are one of those 21st century health threats that we must start preparing for, because the threat is already here. In the past 10 years, millions, hundreds of millions of individuals in our country have had their health information compromised through their interactions electronically with healthcare and public health. When you look at the population of the United States, we're approaching a quarter to a third of the population that we could say pretty safely had their information breached through our electronic systems. So it's a tremendous burden. Right now, and since 2015, the healthcare and public health sector has been named by most analysts who've looked at this as the #1 sector targeted by cyber breaches, by cyber attacks, leading to between $6 and $8 billion of loss to the economy. So this is a real threat and it's here. What does this look like? What does a cyber attack in healthcare look like? How does this affect us? How does it affect public health? So to look at that, I'd like to go back a year. And please think back to Preparedness Summit 2017. Just 2 weeks after the summit closed, the date was May 12th. It was a Friday morning. Our colleagues across the Atlantic in the UK were starting their day's work. Clinicians coming into work, logging into the systems that they use for diagnostics or bed tracking or hospital administration. And instead of seeing that home screen, what they expected to see to start off their day, they saw this relatively polite but disturbing message. Oops, your data have been encrypted. Please send $300 in Bitcoin to X. And this wasn't just one desktop. This was not just one facility. 200,000 computers around the world were impacted almost simultaneously as this malware attack spread throughout the globe. And it hit the National Health Service in the UK particularly hard. It affected about a third of their largest healthcare providers in the country. 27 acute care facilities, 7 emergency departments either had to divert patients to other facilities or call in additional staff just to treat patients due to the disruption from the cyber attack. And 20,000 patient appointments were canceled. So this has a cost, and it has a human cost. And I want to provide you an example of one individual who was affected by the WannaCry ransomware attack in 2017. This is from the Guardian newspaper, and this is a quote from a breast cancer patient in Lincolnshire. I was halfway through my chemotherapy infusion when the attack happened. The treatment finished without a hitch, but I then had to wait for a couple of hours for my medications to take home. That's because all drugs have to be checked against prescriptions, and they are all computerized. The horrible side effects, the nausea, the exhaustion, the dizziness, kicked in while I was stuck in rush hour traffic coming home. There were other patients in the ward waiting to start their chemo whose drugs had been delivered, but again, couldn't be checked. So administration was delayed. In some cases, treatment had to be postponed entirely for another day. The oncology nurses and the hospital staff were brilliant throughout, reassuring patients and doing their best in difficult circumstances. They were also deeply apologetic, frustrated that they couldn't do their job, and angry that such an act had put patient treatment and lives at risk. This is what cybersecurity means to healthcare. It's not a technology issue for us. It's an issue of people. People and their privacy, people and their sense of security, people and their well-being, even their health and safety. In this 21st century, rely on effective cybersecurity. And we know this, but what does that mean? What does that mean for us that are practitioners in public health preparedness, that may be in federal, state, local government, working in health departments, working with healthcare system partners? What does that mean in our day-to-day lives? Does this mean we all have to become cyber experts? Go take online training, learn to code, put a Star Wars t-shirt on, become the cyber warrior of the future? Or does it mean we say, this is not our problem? This is for the IT staff to deal with. My county government manages this. I don't manage this. I don't work with the healthcare providers. I work mainly in public health. Where does that answer lie? What does it mean? What can we all do in our roles to deal with this problem? So today, we're going to ask for your help in answering that question. We do have a system of the Poll Everywhere system to get your feedback, and we'll be using that feedback throughout the presentation. It'll be extremely valuable after the session to know what do you think your role is. And we also have a great set of panelists who will come here and expand on your answers, provide their commentary, and share their experiences with healthcare and cybersecurity. So before I bring them out, I ask you to please start or log into the system. You can either go to Prep Summit 4 you text Prep Summit 4, the number 22333. Hopefully you've done this in one of the other sessions. Or rather than texting, you can also visit the website pollev.com /Prep Summit 4. So you'll see the instructions on either side. Again, it's either a text option, texting 22333 to Prep Summit 4, or go to the website pollev.com /Prep Summit 4. So while you're all doing that, I will bring out our group of panelists. So coming out, we have Mitch Stripling, Teresa Meadows, and Kippy Harris. I'm sorry, I'm going through my notes here. And I'll do a brief introduction for each one of them, and then we will go in and have them provide some perspectives initially on what cybersecurity means for them. We'll start with Mitch Stripling. Mitch Stripling oversees agency preparedness efforts at the New York City Department of Health and Mental Hygiene, including units for planning, training exercises, risk analysis, and evaluation. He coordinated citywide planning for the 2009 H1N1 pandemic and served as a planning section chief at the Department for the responses to Hurricanes Irene and Sandy. The Ebola crisis, as well as the international epidemic of Zika virus, and led the agency's 2017 efforts to support Puerto Rico post-Hurricane Maria. His group has developed nationally recognized threat response guides for 21 of the highest risk scenarios that could impact New York City, a data consensus-driven risk assessment methodology, a principal scientific advisor model for public health ICS, and a robust public health response system capable of responding to a wide variety of threats. Prior to working in New York City, Mitch worked for the Florida Department of Health. There he helped plan and implement the responses to 6 federally declared disasters, including the 2004 record-breaking hurricane season and Florida's response in southern Mississippi after Hurricane Katrina. Mitch, I'd invite you to say a few words on your perspective on the role of healthcare and public health and cybersecurity.
Sure. Thanks, Stephen. Thanks for doing this, and thanks everybody for sticking around. You know, I think there was this time in human history where every new weapon was considered cute. Right? It was like 1,000 years ago, those nerds over there playing with gunpowder, you know, in the corner. And I think cyber has kind of been like that. And I think that it's time for us to take this idea of the cyber attack seriously. Let's focus on the attack part instead of the cyber. You know, people talk about the word cyberspace, which was coined by William Gibson in the 80s, but it was actually coined in a story that was about data theft. So the idea of stealing data has been baked into this kind of virtual world we live in from the beginning. And all of us now are such cyborgs. Everybody out there who's live tweeting, including me, is a cyborg. We're kind of like part computer at this point because we're living in such virtual worlds. And what that means is that when you attack those virtual worlds, it will have real consequences. It will have real consequences on health, real consequences on healthcare. We've seen that start to happen, but I think in the next 2 or 3 years, we're going to see it really move to a new level of threat. And I think that's why it's so important we focus on it now.
Great, thank you very much, Mitch. And next I'll introduce Teresa Meadows, who is the Senior Vice President and Chief Information Officer for Cook Children's Healthcare System, which is based in Fort Worth, Texas. It's a national award-winning, not-for-profit integrated healthcare system comprised of 7 companies. She leads a team of 150 staff with initiatives that include deploying business intelligence, advanced clinical systems, and enterprise resource management. Teresa has more than 15 years of experience in leading efforts for incorporating information systems as a mechanism for facilitating process improvement and efficiency. Prior to joining Cook, Teresa was the National Director for the McKesson Community of Excellence for Ascension Health Information Services. In that role, she led the strategic direction for clinical information solutions that cross healthcare settings for 10 facilities within Ascension Health. And I can say most recently, Teresa was the private sector chair of the Healthcare Industry Cybersecurity Task Force, which released the report last June, which has provided HHS and our healthcare system partners our roadmap for addressing cyber threats in the years ahead. So Teresa, please welcome your perspectives.
Yeah. Thanks, Steve. It's a pleasure to be here. I lived in Atlanta for a long time, so it's always nice to come back here and see the great city of Atlanta, and thank you for allowing me to talk about this. I work at a very large children's hospital, and I am responsible for all the technology and security for that organization. And when we look at it from a technology perspective, that is really the smallest component of cybersecurity. The biggest component that I think everyone needs to focus on is really the education and preparedness and the planning that needs to go into being prepared for the attack. As Mitch said, the cyber part of that is really the smallest component. And when we were working on the Cybersecurity Task Force report, it was really important to all of us that we focused on the lowest common denominator. So it's important in healthcare, we're all very connected. And so every piece of the building blocks of healthcare, including public health, including the smallest doctor's office in a small town, is important in your cybersecurity strategy and people understanding what to do with those partners that we have. I started my career as a nurse. So when I look at cybersecurity and the things that we need to do, I really focus on the patient safety aspects of cybersecurity. If you heard what Steve said, the biggest issue with those attacks was we could not take care of patients, and patients were impacted. So think about cybersecurity as a patient safety issue. Then you will approach things much differently than a technology issue. So in my organization, they always ask me, how many people do you have focused on cybersecurity? And I say 7,000. Everybody in our organization, their role is to have some purpose in cybersecurity, whether you're providing care at the bedside or you're an environmental service worker in our organization. So really focus on the people in your organization and what their roles are, but the primary goal is to keep our patients safe, and that's why cybersecurity is so important.
Great, thank you, Teresa. Next, we'll introduce Kippy Harris, who has 29 years of experience working in communities and with state and national partners, and has led to expertise in improving health outcomes and assuring equity for all populations. She was named director of the Mecklenburg County of Health Department in October 2017 after serving as the interim health director for 3.5 months. Ms. Harris is responsible for managing the department of over 800 public health professionals and a budget of $72 million. The work encompasses clinical services, preventive health, case management, health partnerships, and population health. Ms. Harris was a health director in Buncombe County for 6 years in Wake County. I'm sorry, I must have missed that. Buncombe? Buncombe, sorry,
Asheville.
Thank you. Thank you.
Everybody knows Asheville.
For 6 years in Wake County, serving as the health director for 10 years in other leadership roles in the department for the previous 7 years. During her tenure there, she won the RWJF Culture of Health Prize. Her experience included the facilitation and management of transition from a single county health department to a consolidated health and human services organization within the county. In addition, Harris was the founding executive director of the hospice program in Caldwell County. In former life, she was a cadre provider, nurse practitioner. She was a care provider, nurse practitioner at a rural health clinic in Wilkes County. Kippy, I'd like to know your perspectives on healthcare and cybersecurity.
Mine is probably just a little bit different than everybody else's. Obviously, from my bio, I am not engaged and involved in cybersecurity and the work that I do on a day-to-day basis. But I do believe that it's critical to any local health department and any group that's involved in preparedness to be up to date and understand what's going on here. The reason I'm here is Mecklenburg County experienced a ransomware attack in early December. And our experience with that was difficult at best. Every system that was hosted by the county went down. We had to rebuild all of those systems. The county decided not to pay the ransomware amount, which was about $25,000. I think it was 2 Bitcoins. And it has taken 4 months and millions of dollars to rebuild all those systems. One of the first things that happened is our partners in the community, the hospitals, EMS, our police department, quit taking our emails and quit corresponding with us. They were afraid of what that would mean for them. And so our ability to communicate went down to the basic common denominator was person to person. It really made us look at our COOP plans, what we had involved in our COOP plans, what kind of backup systems we have. And I can tell you for a fact that when you ask a millennial to start doing their work with paper and pencil, they look at you as if you're crazy. And they really don't know where to start with that. So I think that we have got to pay attention to this. I will tell you that when we decided not to pay, they doubled down on their attempts to get into our systems. That has not stopped. I got an email last night that we've had additional attempts to get into our systems, and every county employee, which is about 15,000 people in our community, have had to reset their passwords one more time. So it doesn't stop. And just a personal note, I spent 2.5 hours on the phone with Verizon night before last because my personal Verizon account had been hacked, and someone had added 4 telephones and 4 lines to my account. So it's out there, it's not going away, and we have got to come up with better ways of addressing this and dealing with it so it does not affect our ability to take care of the individuals that we're responsible for in our communities.
Great, thank you very much. Now we're going to have a little bit of fun. We're going to get some audience participation, and I believe this is the first time that this may have been done in a plenary session here at the summit, having an interactive, scenario-based sort of tabletop exercise as part of our closing plenary. So let me give everyone one last chance. If you haven't logged into the system yet, please do text Prep Summit 4 to 22333 or visit polev.com/Prep Summit 4. All right, here we go. Here's the scenario. It's currently one of the worst flu seasons of the past decade. Nationally, the disease burden, both in the numbers infected and the number of deaths caused by the flu, is higher than average. Disease surveillance reports from hospitals and clinics in the county are showing high rates of infection. And this is your county. Think about this. This is your county where this is happening. the number of cases per day is still rising. Surveillance and vaccine records are saved and uploaded onto your jurisdiction's disease surveillance database, which is maintained on organizational servers. Hardware and software systems within your organization are at least 5 years behind current technologies. Sound realistic to people? Probably in many organizations, we experience those issues. And your organization utilizes basic antivirus software to protect agency systems. Again, maybe reflect our own experience. The organization's servers have not been backed up in almost 2 years. So think about most departments that may be out there. You'll have different levels of IT readiness, and think about where would our systems be in this type of scenario. Earlier today, a handful of health department employees began receiving suspicious emails from what appeared to be federal investigators requesting employee personal information. They threatened legal action for failure to respond. A health department employee clicks a link within the email exposing the health department to a computer virus. The virus spreads to healthcare agencies and other health department partners in the community through automatically generated emails that are disguised as coming from health department employees. Within 2 hours, the bad actors that created the virus send emails to infected email addresses stating that your organization's systems and servers will be held hostage until further notice unless $20,000 in bitcoins are transferred to their account. The bad actors also claim that they will release health records containing personal identifiable information publicly if the ransom is not made. Shortly thereafter, all server data become no longer viable, and email systems go offline at infected organizations, including public health and healthcare organizations. At hospitals, this results in an almost immediate disruption of patient care, as hospital staff scramble to coordinate healthcare functions in the absence of primary system functionality. So that's the scenario for our exercise. And please, hope we can follow the normal exercise rules. We don't fight the scenario. We assume these things have taken place and that this is the environment in which we find ourselves. But the question is, what do we do? What are our roles? Wait for the issue to resolve? Is there some action we need to take personally? Do our partners need to become involved? Let's think through that with our panelists. So I'll join them down here and we'll begin with the polling questions. Oh no, we've had a breach. That's embarrassing. No, that was our transition slide. This is our first question. Wow, we already got people responding. Hopefully they're responding to the question. Let's see. So the first question we want to ask everyone is, let's get to know you. What type of agency do you represent? Can everyone see the responses there okay up on the screen? If not, it's A, local health department, B, state health department, C, federal agency, D, hospital or healthcare, E, emergency management agency, F, nonprofit agency, G, private business, and if we have missed anything, there's an other, which is H. So you'll either text this to that number 22333, or if you're doing this online on the website, you'll plug it in there. So please take a second and give your responses. Choose carefully. All right, looks like we have local health department in the lead with 60%, state health department 20%, and not-profit 8%, our top three there, and the few proud federal agency 5 to 6%. Thank you guys for chiming in as well. Let's move to the next slide. That was our warm-up. Here's a question looking at the scenario. Given this discussion, given this scenario, what do you think your organization's preparedness program or staff role would be in responding to this cyber attack scenario? Think about your own role, your team's role. What part would you be playing? And if you can see up there, the answers are A, no preparedness or program staff role. B would be a limited role, receiving information and updates. C is a moderate role, or D is a major role. You'd be taking the lead on many of these initiatives. So as the responses continue to come in, looks like we have a couple of leaders there right in the middle. So between a limited and a moderate role, sharing about the same number of responses. I think maybe, surprisingly, 20% saying a major role. As we think about public health and a role in cybersecurity, that's probably a significant number there. But then we go all the way down to 8%, which say, we would have no significant role in this. This would be someone else. So I'd like the panelists, and please chime in, whoever would like to start. How would you react to this and how people are perceiving their roles in cybersecurity?
Well, let's get practical. So we've done a big functional exercise on this. We did an exercise series with all of our hospitals over the past couple of years. And so we have a playbook for this. And the playbook strongly argues for a major role. So I'm not going to start, voting myself up here right now, but I'm going to argue for a major role with really 4 key components out of the gate. And I think the smallest of those is the cyber response itself. But you have to stand that up, you have to get IT security in play, you have to start walling off your networks. At the same time, you have to start figuring out how you're going to do your job. We have public health services we need to do. Suddenly we have no syndromic surveillance systems, right? We have no database access. We can't access the information of our clinic clients. Those are major problems that prevent us from serving the public. Then we've got to have a legal policy framework in place to make some decisions. Are we going to pay that ransom? That's the question of the hour, right? Atlanta didn't pay the ransom. Anybody here work for the city of Atlanta? You guys have been going through this. Cost them, I think, $2.7 million over a 50 grand ransom. It's a hard choice. I'm not saying what the right choice is. And then finally, you've got to tell the story of this. This is going to be a massive communications problem, and you have to get out in front of it. So for me, those 4 components argues for an ICS response, a response like you would for any other threat or attack that hit your community.
Great, thank you. Other thoughts?
Yeah, I don't know if I have much to add, but I do agree. The other thing is just looking at the communication you have internally with your staff and the communication that you're going to have externally to the public. These events are reputation damaging at best. And how you respond to the public outside your organization and how you address your internal staff and employees is very different. And so keeping those things in mind as you're starting to talk through that response is very important. And I would challenge everyone to start thinking in the major role category. I agree 100% with Mitch. I think there is no entity too small to play a major role in this process because when these things happen, it becomes a team sport and a team effort, and that we all have to band together and work very collaboratively and actually have plans not only for our own organization but the organizations that we interact with. So I would encourage people to think about the more major role position on the question there.
Thank you. Kippy?
Yeah, from a real life perspective, I mean, unfortunately we didn't have the practice that you've had before this sort of hit us in the face. And I will back up everything that everybody said at this point. I think the first thing you have to do is figure out how to wall this off. And IT is critical in that. But then you've got to figure out how you're going to continue to provide service and how you are going to communicate. Communication's key. And you're going to communicate with lots of different people. It's not just going to be with your staff and with the people in your community. You're going to be talking to the federal government, to the state government. People are going to be worried about data breaches, whether information has been lost. All of those sorts of issues come into play. And having somebody that keeps an eye on and organizes that work for your department is critical. And for me, it's the preparedness coordinator who has the ability to do that. I mean, we've done that with lots of other types of activities, with practice, and sometimes with real life experiences. But so that person's already in that role of playing that convener and that person that keeps you organized and moving forward. So I again would go with the major role. I think it's something that if you haven't thought about, you really need to start thinking about how you're going to step into that and what that's going to look like moving forward, because it will happen.
Great, thank you all. So here we have our final results up here, and of course all the results I should have mentioned we'll be using later to do analysis and to see what is this that we see is public health, as a public health preparedness community that we currently see our roles in, and where are some areas that we should be working in the future. So let me move to the next slide. If this attack happened at your organization, what is the first step that you would take? And I'll read down. You can discuss the activation of the organization's cybersecurity response plan. So if they have a cyber response
If available. That's key.
You can write one real quick, and then you can implement it. B, notify FBI or law enforcement. C, check the functionality of key organizational systems. D, start a GoFundMe page. See if some aunts and uncles are going to send you some checks to get your health department back online. And E would be none of the above. So right now, we have a lot of people calling the FBI. We have about a third of you activating your cyber response plan. So we'll want to dig into what that means. Does that mean your all hazards plan and you're adapting it for a cyber response, or are you actually blowing the dust off of the cyber response plan? And then, of course, checking the functionality of systems. Not to be doing the GoFundMe page. That's what you say now, but who knows what you'll be doing. And then none of the above. Actually, a good chunk of people with none of the above. So there are, of course, a lot of things we could be doing, and this is a small sample. So who wants to answer first? What would you be doing personally as your first step in your organizations?
Yeah, if I looked at Cook Children's, I mean, we're lucky enough that we've prepared and have a plan. So, our plan would include notifying the FBI. It would include checking functionality. So we would probably start by pulling out the plan and going through the steps that we've outlined. I think we're probably a rare organization that we actually have the plan and that we practice a plan. I think many organizations don't do that, and I do think contacting some law enforcement agency is your best next bet, because they can provide you resources and suggestions on what to do next if you don't have the ability to have that plan already thought through. And definitely check your systems and wall those off as soon as possible, because that's really your point of entry and you want to get those things done. But I would encourage all of you, even if it's a rudimentary plan, a Word document, a handwritten document, have a plan, at least the major steps that you would go through as you move forward. It doesn't have to be something sophisticated where you hire a huge consulting firm and do those things. It's really just thinking about what you would do in your organization to be able to be successful and mitigate as much risk as possible early in the process.
Well, and what we experienced, number one, we couldn't get to anything online. So make sure that you continue to have paper copies of your plans. We try to do everything online these days. We try to reduce paper, but when you can't get to it because the systems are shut down, then you're sort of dead in the water. So make sure that you've got those copies available to your staff. One of the things we had to do very quickly was communicate with our staff, because the process for us, they actually accessed a couple of IP addresses for some of our staff. And these were people that we knew. And then they attached a Dropbox document to it and asked people to open it up and give them their thoughts. And so we had some staff that went in and did that. So staff needed to know quickly to stop and to not open any more documents. We had Homeland Security engaged and involved with us almost immediately. In Charlotte, we have a number of large banking systems, and they have cybersecurity experts that work with them, and they came on board with us very quickly. That was critical for us in terms of making the decision about whether we developed a GoFundMe page or whether we decided we weren't going to do that. And I can tell you, paying the ransom will be a whole lot cheaper than building it, and these guys depend on that. They think it's going to be just the smartest thing for you to do. Go ahead and pay it, and they'll get you right back up. So just all of those things you have to consider. The next thing for us was really making sure that our data was secure and that there had not been a data breach, and talking to the folks that we need to about potential HIPAA issues. That was critical for us. And then communicating with our community partners to let them know that we'd be communicating with them in different ways, whether it was around communicable disease issues, whether it was anything with law enforcement or with EMS or anybody else that we work with in the community. So those were some of the steps that we took right off the bat.
let me add a couple things from our perspective towards this 4-part strategy of IT response, get your essential services working, communicate the story, and the kind of policy wing of things. And I'm going to focus on the public health service part of this. What do you need to do for that? So when we stand up our EOC, first we bring IT security into our ICS structure, right? They're not always there, but they become a key part of our operations sections. We have what we call an ICS in a box protocol. Literally, it's ICS in a box, not actual ICS, but the paper forms that drive ICS that we use. We have voice over IP phones. So I don't know if you guys might not know this, but a lot of phones run on IP protocols now, and they could be hacked, and those were out in the scenario that we were working in. So we had to set up a couple of other communication pathways. We figured out what our plain old telephone system line was, POTS lines, the copper wiring or other things you have, and we put people on those phones, EPIs, people working surveillance. We had to institute a runner protocol where literally we had staff running from one part of our operations to the other to ferry messages back and forth, to get messages to the commissioner. And we also sent staff out to healthcare facilities, out to hospitals with phone lines so that we could communicate back in surveillance. We were doing outbreak investigation, right? And if you do outbreak investigation and suddenly you don't have, our system is called Maven, people have epidemiologic systems now, you've got to go back to paper, but you've got to do the shoe leather reporting. So we suddenly had bunches of our staff all over town. Working on these issues, doing outbreak investigation, getting the results back. So you really have to flip your whole organization's mode of thinking in pretty short order.
I'd actually like to add to Mitch's comments. At HHS, we've taken cybersecurity as one of these 21st century health threats and incorporated that in our all-hazard structure. And our intent is to respond to cyber attacks like we respond to any other hazard we respond to. Yeah. Of course, maybe using different functionality, but organizing it the same way. And when we had WannaCry in 2017, we did just that. We organized through the Secretary's Operations Center. We had our IT colleagues come in, of course, and they ran the department's efforts to make sure our systems were patched and all of that, but they plugged into that ICS structure, and it really helped us to coordinate that response with what we were doing with private sector organizations, healthcare providers, pharmaceutical firms, and letting them know about the threat that was out there. So these structures we use for emergency preparedness, they can really work for a wide range of hazards. Yeah. Okay, looks like and we got response plan activation as our top one there. And also notable that people talk about the FBI and notifying the FBI. I do want to stress the importance of that most, if not all of the time you have a cyber breach, it is a law enforcement issue, it is a crime, and they are often the best positioned entity to deal with that, except in some states and cities that do have a cyber capability at the state or local level. But FBI at the field office level is often where to plug in. Okay, then the next slide, what preparedness measures, looking before this incident, what preparedness measures would be most effective in helping the impacted organizations prepare for cyber attacks? So maybe what are some things that you would be doing? Conducting preparedness exercises is A. Develop COOP plans for system outages, B. Define organizational roles, C. Conduct a risk assessment, D. Or develop relationships with emergency management in IT, E. So it's tough to choose your favorite, I'm sure, but all those are good ones. But what's that one thing you think would really take you far in getting better prepared for cyber incidents? So it looks like we have continuity of operation planning as a top one, as well as conducting a risk assessment, followed by exercises. So what do the panelists think about that?
Yeah, I'm torn between two. Because it's really difficult to develop a plan if you don't know what your risks are. So, I would think your first step would be to have a risk assessment done or do your own internal risk assessment about what potential risks are, and then develop your plan for each type of risk. So ransomware may be one plan, but malware or some other thing might be a different plan. So I think it's very important to understand what the scale of the risk is and develop those plans based on what could happen. I think the two are tied together, so I can't vote. Can I push? Can I select two? Because that's probably where I would end up.
Let's get two phones. You can do
yes,
that. Yeah, that's the hack. You get two phones, you can vote twice.
I'm going to lean towards the risk assessment side, and I guess The real reason is, when you think about WannaCry or SamSam or these things, the terrifying part is they're usually already there, right? The way these vulnerabilities work, it's not that they attack you one day. It's not like they targeted Atlanta, for example. These things are just out there, always looking for a hole, and then when they find a hole, they take you down. And so what we did is New York City founded a cyber command. We have a New York City Cyber Command, which is like the coolest, organization name in the world. And they did a risk assessment of our cyber vulnerabilities right before WannaCry went. And one of the reasons it didn't hit us as hard as other places is because literally they had just done a full vulnerability sweep. And we had instituted a couple of IT protocols that became very important. One of them is a list of approved applications. Nothing can be downloaded or installed. If you click on something, it doesn't load up unless it's on an approved list of software. For instance, we weren't allowed to do Poll Anywhere, the Poll Everywhere, the software. We couldn't use it in New York City because it wasn't approved software. They thought, y'all were trying to hack us, so we never used it. But those measures became really important.
Great.
And I agree with the assessment and then the COOP plan, and I'd probably put something in between the two, because once you've done your vulnerability assessment, working with your IT folks to make sure that your systems are as strong as they need to be, the type of thing that you were talking about. We've made major changes in the county in the way people use IT now that we did not have in place before. And I think that is, but you've got to be engaged and involved in that conversation, because otherwise they're going to be creating things that are going to make it hard for you to do your work.
Yeah.
One of the things that we've discovered is yes, they blocked a whole lot of websites. And, when you're working in STDs, some of the websites that you go to, most folks in county government aren't going to recognize the need for those. So you've got to have systems in place where you can actually make sure that staff are able to get the work they're done. And I do think that, all of that gets built into your COOP plan, but it's all part of, you need to make sure that you've got the systems in place that you need to protect.
Can I add one more? That I was surprised by this, actually, when I was meeting with our IT folks before doing the session, is we don't back everything up. As an outside person, I thought everything was magically backed up somewhere. It's not true. You have to ask for certain systems to be backed up in certain ways. That's a program ownership issue, not an IT issue. So you need to sort of say, and we did this, what are my essential services, what do I need, and then make sure that they are backed up. In our case, we want them backed up both in the cloud, so that they're not on a server that we control, and also physically, so that they're disconnected from the network. So backing up your critical stuff to the cloud somewhere they can't get to it, but also, in a box somewhere so that you have a version when you need it. I was really surprised by that, and I imagine a lot of you guys are in a similar situation.
We actually lost some information. One of the ones that I can think of is we did a lot of mapping in our environmental health area. So mapping of different sites, mapping of different things in the community that we had been watching over years, and that was not being backed up. So we lost years worth of maps. A lot of our stuff is backed up, but the other thing that we discovered is if they attack the county system, or if your health department system is separate from the county, if they attack that system, if your systems are hosted by the county or by whatever system you use, that's what's going to go down. Our EMR was hosted outside of our county system. It never went down. Some of our other systems were hosted by the county, and they were gone and had to be rebuilt. So we're taking a look at where our systems are hosted now as well. Because most of those places that host off-site have backups and backups that counties don't always have.
Steve, I might just add one final thing on the backup discussion. Having all the backups in the world is very important, but if you never test restoring them, that's also could be a huge issue. So it's not good enough just to have the backup. It's very important to periodically try to restore your data or your system from that backup, because you could have years and years and years worth of backup and not have any technology to reinstall that thing. So as part of your plan, you want to practice restoring from a backup, because people have backups and then you can't use them. They're really old, or they're not, the technology has changed 10 times, or different things. So practice making sure you can even get it back up once you have that backup in place.
Great points. Yeah, that's great points. And I'll add one thing. We were talking to a healthcare emergency manager, a hospital emergency manager that got hit by a very significant cyber attack. And he said one of the things that was really helpful to him is almost just a couple weeks before the attack, he'd seen a cybersecurity presentation, was thinking about the importance of it, and reached out to his chief information security officer in his system. And they started talking about, we needed to start developing a plan and so forth. Well, the attack happened almost immediately after that. But he said that, like everything else in emergency management, having that initial contact with a person that's really the important person to talk to in that incident, it's the difference between going from 0 to 60 and going from 50 to 60. They'd already at least gotten the initial handshake in place, and when the incident happened, they were clicking and they were off and running. And so just think about that. Often it just is that reaching out that can really help. The next question, what is the first thing related to cybersecurity that you will do when you get back to your organization? So it's either request an update to computer systems, which is A, B, implement mandatory periodic cyber training, B, C, request that servers are regularly backed up, or D, initiate the development of a cybersecurity preparedness plan. Of course, this will vary depending on your role in your organization, but we just want to know, what are people's roles? What is it that you particularly would be doing in this incident? So we've got D is pretty high up there. And that makes sense with emergency management planning so big in everything that we do. Then we have, I guess the next up there is implementing mandatory training. And that is an important thing. Every single person that you work with is a potential vector for an attack to come in. All right, let's have the panel respond to these results.
The most effective thing, actually, it's kind of this is an embarrassing story of mine, so of course I've got to tell it while you're on stage. After the coastal storm seasons, I was deployed to the Virgin Islands for a while, and I still had my work phones and stuff, and I was really exhausted one night. I was reading through the phone, and I saw I had an Amazon package on my little email, and I was like, oh, I have an Amazon package, and I clicked on it, and then I realized it was my work email and not my home email. And then I was like, oh crap, what did I just click on? And then my phone lit up and it was like, surprise, you fell for our phishing test. Because the New York City Cyber Command was testing to see if people were going to click on links like that. And I fell for it. And then when I was meeting with the IT chief a couple weeks ago, he was like, I know you failed our phishing test. I just want you to know. It was embarrassing for me. It was a good moment for him. But that was the number one thing, actually, that has been most effective for us, because when that first phishing test happened, a significant minority of staff fell for it, because usually things like that are blocked. And since then, they've done 2 more. And they've really dropped down, but it's also really raised awareness about cybersecurity, and it's making our work on cybersecurity preparedness planning much easier now, because it really raised buy-in, because suddenly the whole organization was much more aware of the threat and how they were kind of a part of that threat, if that makes sense.
Yeah, just to add to that, we do regular phishing attacks as well. And don't underestimate the need for ongoing training.
Yeah.
Training is so important with the staff, because this is not something that they experience on a regular basis. And with phishing attacks especially, it is very difficult to know that it's actually phishing. You have to have a trained eye, and it takes lots of seeing of the messages. We actually do something similar in our organization, except the lucky thing is your training pops up if you click the link. And you right then have to watch a preparedness video. And I also get the list of all the repeat offenders. So we have some people now in our organization who've failed many times, and so now we're working on ways to give them further education. But at some point, if you continue to fail, we have to look at other opportunities, right? Because it's very important that everyone knows. And there are simple things that you could ask your IT team to do. So for example, in your email system, you can have them put a big red warning or some warning on all emails that come externally from an external. And that is super simple for your IT team to do. But at least you see that warning, and when you read it, you're like, this says it came from our CEO, but it has the big external warning message on it. Maybe this might be phishing. And so there are very simple things that organizations can do. And in your email systems, that's an easy thing to deploy. So if you wanted to do something, just minor education or something that didn't cost a lot of money, just having that internal email be red flagged, people will take a second look at it then. We've had many instances where people spoof our emails and send emails that say, please pay this person ASAP. And we've had things get all the way to our AP department and almost paid, where people miss that this is not our CFO asking for this to be done. And so it's really important, the ongoing education. We do weekly, monthly, daily education with people about different ways that they can protect themselves, not only at work, but personally too. I think it's really important to know what you can do personally when the Verizon problem happens, right? And so if you have good hygiene at home, hopefully that also carries forward into your work life as well.
So we now have the little strip across the top of the email. Ours is bright yellow.
Yeah.
That says this is an external email.
Yeah.
And interesting enough, we had several opportunities for training that were offered to staff but not required. Yeah. Like a month before the attack happened. And now everybody is required to go through training, and they've instituted a number of things that there's some things that they can put in place that actually prevent you from falling for phishing things. Like we can no longer connect with our home email, our personal email. We cannot connect with that. On our county systems. We cannot open Dropbox or a couple other types of documents that tend to be shared. So there are lots of things that can happen. I guess the other thing that I will say is you're thinking about your cyber preparedness, your security preparedness plan. One of the things you need to include in that, whether it's in your COOP plan or whichever plan it is you develop, is you need to think about what systems you're going to prioritize to get back up. It's much easier to think about that ahead of time than it is to think about it when you're in the middle of things and everybody is advocating. Because we ended up having to advocate with every county department for what systems needed to be back up first. Our criminal justice systems went completely down. The library went completely down. DSS went completely down. And so we were competing with all of those other departments. And if you've already got that planned out, then you're not having to do that at the time if it does happen to you.
Thank you. All right, we're on to our final question. It looks like planning is going to be the big thing for people when they get back to their office, with 79% saying they will work on a plan. And I think just to mention it, that as much as we can incorporate this within all hazards planning, not create separate plans for every hazard we work on, certainly is good. It's also in planning efforts like this, it's important to bring in the IT staff who have their own plans, but to get their buy-in that they're part of your all hazards plan at your organizational level. So now, we know in the federal government, myself and others that we work with, that this is an important issue, that it's something that's spreading across healthcare and public health, that there's something we need to do about it. We need to provide assistance in some way to make sure that this can happen, that we can protect ourselves. But it's often challenging to know what are those things that people need from the federal government to assist with cybersecurity. We're not going to be able to deploy, programmers to go down into your local area and teams of cyber professionals to work with everyone. But maybe there are things we can do in terms of sharing information, providing coordination, guidance. So let us know what your thoughts are on that. So we have A is additional cybersecurity planning guidance. B is information on what federal resources are out there. C is messaging guidance. D is updated IT systems and firewalls. Is there some kind of technology that government can help with? E is training for health department healthcare staff. and F is cybersecurity is not a priority for my organization. I'm so happy to see no one's put that one on there yet. So thank you guys, I appreciate it. That's real steam boost for everybody up here on the stage. Oh no, now we go. I just jinxed it.
I think that was just to mock you.
That's mock, yes. The rest of the Asper staff doing that. All right, so we have the top one, looks like information on federal resources that are available. One thing I can say is that when we mentioned Teresa co-chaired the Healthcare Industry Cybersecurity Task Force, that report is up on our website, and there's a great appendix to it, which is there's a link right there on the website to the appendix, which is just resources for healthcare and public health organizations on cybersecurity. It's not too long. It has resources for people at every level, those that just want entry-level type of stuff, those want more technical detail, it's in there. So I'd encourage people to look at that. That's on our phe.gov website for public health emergency, phe.gov.
Yeah, and I would add, I had never interacted with the federal government until participating in this task force, and I was amazed at the number of resources that actually exist that don't cost us anything to use, that very few people take advantage of. And so I would reiterate what Steve says, please look at the list, because there's lots of resources available to you that really it's just reaching out and asking for them. And so that was probably one of the aha moments that I had is, wow, there's a lot of things that I could have taken advantage of that I didn't know existed. So please look at the list for sure.
Great.
And a couple things, and I'll say federal and state, to add on. I think that is a great report. It's a really good starting place. Celia Quinn in our hospital preparedness program did an exercise series with hospitals in New York City, during which the hospitals that had plans went from like 30% to 80%, but they had some feedback. And of those hospitals, there were 3 key things people were looking for. Number one is hospitals were really unwilling to share when they were getting hit with something, because they saw it as a competitive thing. They didn't want to let people know. And they really need to, because it's obviously a threat to everybody. It's a threat to the community. So they need better guidance from the state and feds on when to share and that it's safe to share. They are looking at questions of how much money to spend on this. We're all looking at that question. How much of my operating budget should I put towards this threat? And it would be good to have some standard guidance. And then last but not least, there really isn't a national playbook for this. I think that report starts to get there, but the same way we have national playbooks for other threats, we really need some help with a federal playbook for how to respond to this and a regulatory framework that kind of goes along with that.
Great, thank you. And Kippy?
I'd say yes. We can use all of those things. I think it's important for us to make sure that we're aware of what's available out there and make good use of it. There's no reason to ever reinvent the wheel. And, I think there are enough of us who have experienced this that when people have questions and want to know how different groups handled it, I think they're willing to share that information. So, but I do think there is information out there. You just need to go get it.
Great.
Yeah.
Well, I'm sorry, go ahead, please.
2 things. To Mitch's point, that was a huge discussion about people sharing information. And so the information sharing organizations are very important. And the healthcare actually has a good information sharing organization that anyone can join to start getting this information into your organizations. I think that is a really great next step for people if you're interested in that. The other thing I will plug is that the Sector Coordinating Council now has formed groups to begin looking at how do we implement the recommendations that were in the task force report. And those groups are open to anybody who wants to participate. So if there are people who want more information about that, Steve can certainly share it, I can certainly share it. I'm working on a couple of the groups around policy. So to the information sharing standpoint, sometimes people don't share information because they're worried about things that could happen. So we might have an audit from OCR about sharing, HIPAA information. So people don't share because they don't want to have an audit happen or some other regulatory thing happen to them. So looking at some of the policies and how do we make those more aligned to people sharing information and not have fear of retribution when they do it. I think in healthcare is a big thing right now for us to be able to do that, because the sharing is so important. Because we don't learn if we don't share the information. And so if you have interest in those groups, please reach out. I'm happy to share the information, or Steve can too.
Thank you. All right, well, we've gotten to the end of the exercise scenario and the scenario-based questions, so thank you all for participating in that, for sharing your feedback. Your role is not over, so we have a little bit of time left here with this session. I've heard all flights are on time, no issues at the airport. Actually, I have no idea. Let's assume that that's the case. So in this part, we'd like to just open this up to the questions or observations. Did you have any thoughts as we're going through this exercise? And have some, beyond the poll responses, some thoughts you'd like to share with us or some questions on what we shared with you. So I think we have a first question here right now.
Well, it's just a follow-up to that issue of resources and communication. In the WannaCry attacks, Asper Tracy took a key role, and so those who are familiar with the Tracy web portal, there's a lot of information there now about cybersecurity. It's easy to research, and then, of course, they have in the past taken a key role. I would expect they would in the future.
That's a great point, and ASPR is a great resource for anyone on a number of topics, so not just cybersecurity, but you'll notice there are a number of topic pages in Tracy. Cybersecurity is one of them, and my team works with the Tracy team very regularly to make sure that we keep that updated and put new information on cybersecurity as it comes up, so a great suggestion to look at that. Yes?
Hi, good morning. Thank you for a very enlightening presentation. Lisette Osborne, State of Texas. So, related but off topic, and not off topic, but please excuse my naivety here. I can turn on a computer, I can operate my cell phone, but this is way above me, but very eye-opening. So, can you speak to hardware, pacemakers, programmable pumps, all of those sorts of things, and how a hack could happen, or obviously bad things could happen with that, but.
Certainly, I can start, and I think Teresa probably can share some based on the task force discussions. Everything we do, or so many things we do in healthcare now, are wired and connected, and medical devices increasingly fall into that category. When I said the WannaCry attack happened in the UK, 1% of all of their diagnostic equipment was made unusable during WannaCry. And that's mainly MRIs and X-rays and imaging type equipment. But also we have many implantable type of devices that for very good reasons have internet connectivity, either to do updating and patching or to get information and data out of them. There's a potential for vulnerability there. One thing I will say is that the Food and Drug Administration does have authorities over this, regulatory authorities, and they've taken an approach, because it's such a fast-changing, high-technology area, to work collaboratively with industry partners. And they've really brought a lot of industry partners to the table to discuss this challenge and to lay out some basic guidance that helps manufacturers build security into their systems. So it is a challenge that we need to continue to work on, and it's something that is really important for patient health and safety. So Teresa, I don't know if you have other thoughts?
Yeah, I think the only other thing that I would add, I totally agree. I think we had lots of good collaboration with the FDA on the cybersecurity task force, and it really boils down to a couple of issues. One is legacy devices. So in our organization, we may purchase an MRI machine that we actually build a building around, and that machine was produced 20 years ago before, we had integration to electronic medical records or wireless capabilities and those types of things. So how do you secure devices that weren't designed for cybersecurity issues, and how do we not have to spend a bazillion dollars to replace every medical device that we have to ensure that they have the appropriate security precautions built in? So that's one issue. And then the second issue is, how do we make sure as devices are manufactured in the future that all the appropriate security controls are built into those devices? Because that to me is an easier problem to fix, because now people are well aware that with the Internet of Things and everything, I always say to my team and everybody at our organization, everything we buy, with the exception of toilet paper, maybe, has some sort of technology involved. Even our toilets now have automatic flushing, and if the network goes down, you can't flush the toilet unless you do it manually. So you've really got to look at each thing that you're purchasing in the future and saying, ask the question, can I update this device? Can I deploy virus protection or the appropriate security protection on the device? And if you can't, then you may want to consider what your other options are. But there are a lot of things in healthcare that there's only 2 manufacturers of, and neither one of them are secure. So then you have to work with your IT department to say, we're going to accept the risk of implementing this piece of this medical device, but we want to be sure that there's a way to protect us internally. So we look at ways to segment that particular device on our network or do different things. So it really is a 2-factor issue, because the legacy devices in my mind are probably the biggest issue, because a lot of us don't have a ton of money to go replace everything we have. And so we have to look at mitigation strategies with those legacy devices primarily.
All right, we have a couple more questions, please.
Great, thank you. Monique Mansura with the MITRE Corporation. It's a fantastic panel. I appreciate the leadership of all of you in what you're doing for this threat and all threats. And particularly, Teresa, for your leadership in the task force. The question is about prioritization. We heard about the complex 21st century threat environment, whether it's WMD, severe weather, pandemics, or cyber. So question for sort of ROI for cyber investments and preparedness versus all the other ones, and how do you make decisions in, again, this vast array of threats? Where does cyber fit in, and how do you rank or prioritize preparedness?
So let me try that one, because we're going through a risk assessment process. And I guess what I would say first is it's important not to rank scenarios, but to rank consequences. That's what we care about. We don't actually care how a certain kind of health damage is caused. We care about what it is, and we want to react to it. And the scary thing about cyber is that it opens up a range of new consequences for us, both in terms of our privacy, but I'm going to argue, and I think the Internet of Things gets us there, in terms of new ways to cause health damage. The problem is worse than blood pressure pumps. Think about your HVAC system, which is connected to a network, your generators, which are connected to a network, your power grid, which is connected to a network. If we can stop uranium production in Iran with a cyber warfare weapon, we can take down a generator grid. We can take down a power substation. And so the future of cyber is a future of new attacks that can cause physical damage and morbidity and mortality in new ways. That's why it's scary, and that's why it should be taken much more seriously in our threats, not because it's a fancy new scenario, but because it's gonna create new ways to kill people. Yeah. And we are going to see it kill people in the next decade. I am sure of it, based on all of the information that is coming out in this realm.
Other thoughts?
Yeah, the only other thing I would add, I agree with you 100%. When I do presentations, I have a photo of just one of our hospital rooms, and there are probably 17 different ways that a cyber attack could occur in that patient room because of all the biomedical devices, the electronic medical record. And so we use these things in the prioritization process, exactly to your point. The risk just continues to go up, and you can have all the technology in the world, and you still can't prevent something like this from happening. And so the organization has to understand this is not an IT issue, this is an organizational risk issue. And when you're looking at the scenarios and the outcomes, you have to prioritize exactly how Mitch said. Otherwise, security will always go to the bottom if you think about it as a technology issue.
And I will, I've been involved in preparedness around hurricanes, around other disasters over the years as a health director. And what I will tell you is what's different about this is we responded to those things with the resources that we had, and we knew we were going to have those resources to be able to respond. When something like this happens, it takes your resources away from you, or at least the ones that you're used to using to respond. And so it takes a whole different way of looking at this. And it is, if you're not able to use those systems that you're used to depending on to address other preparedness issues, then you've got a double whammy. So I agree. I think this has to rise to the top. And I mean, the experience that we're seeing is that once it gets started, it just keeps rolling. It's not like it's a one and done, that you can take care of it and it's done. they continue to come back over and over and over again, and you've got to continue to respond and be able to address the issues. So.
Great, thank you. We have another question. Oh, sorry, we have a question over on the side here.
You know, in this day and age, I work for the Office of Public Health in Central Louisiana, and one of the big state initiatives is health information exchange. And so this multiplies all the people that are, all the players. It's FQHCs, it's the hospital systems, it's anybody who's involved in this. How is that coordinated so that, you know, this doesn't happen, so that it doesn't filter back down to the health department?
Yeah. You know, we talked about this a lot because I think, you know, the more connected we get, it's very important that we have the same level of education for everyone. So, you know, I've been a proponent of, my organization's fairly large. We should be the ones going out and educating the smaller organizations and supporting them through this process. Doing education is very easy. And also having a plan together, a shared plan that says if this happens in one of the organizations that we're connected to, either through a health information exchange or some other exchange, how do we react together? Because, you know, the initial reaction is just to cut everybody off, and that may not be the best approach depending on how you want to approach it. So you really got to have that collaborative plan between all your partners that you work with on a regular basis to really start to put a dent in it, because I could be as secure as possible, but all I need to do is connect with one physician's office that has a 2-doc practice and no sense of security, and then all of a sudden I'm vulnerable to that process. And so I think this is a huge leap, and we've talked about many ideas about how we could start doing that education and how could we start working more collaboratively together. That's why I think some of the education that could be provided either through you know, a health information network or a health exchange network where we can actually share information with smaller organizations, and it's more practical. It's not the the secure classified information when you're hearing about the cyber attack and you don't have any idea what they're talking about. You know, it's the, okay, this attack is happening, which I think Asper and Tracy did a great job. This is happening. Here are the steps you need to take. Here's what you need to say to your IT department. Here's what you need to say to your partner to get that done. And that's the network that we need to build, and everyone has to participate. It can't just be the big institutions who participate. But it's a very hard problem, to your point, to solve.
Thank you.
One of the things that we're seeing is that we have contracts with lots of organizations, whether they're community-based organizations or healthcare providers for service, lots of different contracts. And one of the things the county has done as part of this situation we've been through is really ramp up the requirements for cyber security for the organizations that we contract with. And what we're discovering is that we've got a lot of these organizations that can't meet those requirements. So we're having to go back, and that's giving us opportunity to do some of that education and training in the community and getting us on more on a level playing field. But it's gonna take time. And the more of that you can do before an attack happens, the better off you're gonna be when it does.
Absolutely.
All right, next question, please.
Great, and thank you for a great discussion this morning. My name is Mike Moser. I work for a large healthcare system in Connecticut, and I just want to echo some of the sentiments about the integration between emergency preparedness and IT security. It's something that we have engaged, I think as you said, Teresa, for a number of years, that ITS has a seat at the table in our HICS system. They're a regular brief out on any event that we're having. And one of the other initiatives that we've been doing over the last few years is, ITS dealing with their disaster recovery and their business impact analyses, as well as I work for emergency preparedness, and we're doing the business continuity, really merging the two. And now that integration between those two groups, which had not always been in existence, has really advanced. And what we've been able to do with that is now starting to see docs in the ED, nurse managers in the ED, who are recognizing that a cyber attack or the loss of our EMR is every bit as big an emergency as a bus turning over on I-95. So I just wanted to share with that. So.
Yeah, that's great feedback.
Thank you. Next question or comment?
Good afternoon. My name is Kyle Lopez, and I'm from Colorado. So my question has basically two parts, and they're kind of forecast questions. In terms of all the different types of cyber attacks, from my experience, it would appear as if ransomware and phishing have been the predominant leaders within healthcare. As the years go on, do you see that those two cyber attacks will continue to kind of lead the pack, so to speak, or do you think that other types of attacks, such as DDoS, MIT, et cetera, will begin to emerge as frontrunners? And then secondly, to your point about Stuxnet. Stuxnet was such an incredible virus because it was one of the first times in the world that we showed that we can use cyberspace to actually reach out and cause physical damage and destruction. So within healthcare, do you have any ideas of to what type of viruses or software will be out there and how they could actually physically attack healthcare? And do you have any idea of what components of the physical public health care world will probably be targeted first?
I can start maybe with that last question, just a quick comment. We have had physical attacks, even in healthcare, but not to the level that you may be thinking. So there was an incident that happened maybe 5 or 10 years ago now, where a disgruntled former employee who was a security officer did get into a hospital system, hacked into the hospital system from his home, and was able to change, it did change the temperature within a part of the hospital. Wasn't able to create any physical harm, but was able to create physical change, at least in that environment. So we're not aware of any person that's been physically harmed or killed by a cyber attack, from a medical device at least, or from anything that directly connects to them. But we won't always know when this happens either. And that'll be part of the challenge, is to identify when something goes wrong, when the device you're relying on for your patient doesn't work anymore. It may not start flashing red lights. It may just shut off. And those are the types of things that's really hard to identify. So we have a challenge in front of us to know when those things happen.
Yeah, one of the other things we talked about that's sort of in line is think about the whole supply chain process and the manufacturing process that occurs within healthcare, whether it's a drug manufacturer or a medical device manufacturer, or something that delivers healthcare devices to our organizations. That might be the next frontier. Honestly, it might not be the hospital itself. Yeah. It could be to stop that supply chain process in some way that would be an impact. I mean, I think the ideas are probably endless if you're a technology person, of things that could happen. I mean, sometimes you listen to these things and you're like, man, that just sounds like a TV show, or something that won't happen. It can happen if the right person or the right people think about it in the way that they want to be destructive. And so I think we've got to, as much as we can, be ahead of the bad guy a little bit, but it's very hard because in healthcare there are so many points of entry. Yeah. Could it impact a large laboratory where we send all our lab results? I mean, there's just different avenues other than just turning off a medical device or those types of things. So I think we've got to think bigger in healthcare and not so focused on just the hospital or the health department or that right. thing, because there's so many other opportunities.
Pharmaceutical industry.
Yes, there.
And let's think about it like this. My understanding of the next generation of this stuff is, WannaCry exploited an SMB vulnerability, I think. SamSam was a Java vulnerability. And now what you have are nodes that are sitting in systems looking for vulnerabilities. And when they find one, they can go back and get another module, go back to home base and say, okay, I found vulnerability X, and now I'm just going to bring in a new bug, and I'm going to attack that vulnerability. So it's not programmed. So it means that they could sit there for years and years and years and go into your backups and just kind of be waiting around until one day a new employee creates a vulnerability and suddenly everything goes boom. Think about the destructive potential of that in the hands of a terrorist organization that is also doing a complex coordinated terror attack. Right? Think about a scenario like we heard about in Las Vegas last night that happened with that threat agent also triggering a cyber event at the same time, taking your systems down just when you need them most to respond. I think that if you stop treating cyber as something magical, but as just another weapon that's out there that people are pointing at you, this idea of physical cyber joint attacks, I think is real and something that we will see over the next few years.
I think we have time for one more question, then we'll need to close out. So please, go ahead.
So I actually had more of a comment. So my name's Taylor. I'm from Multnomah County in Portland, Oregon. This is a great presentation. It's kind of scary. I'm sure everyone in the room is going to go back and talk to their IT folks, hopefully. But I just want to caution folks that, there's a lot of, so I feel public health can kind of be a little bit delayed when it comes to technology, and there's a lot of tools out there that would really help us improve our work. So I just want to caution folks, if you are in a leadership role where you are making these decisions, that you make sure you bring the right people to the table, because often when people don't understand technology or don't understand the lingo, the first answer is no, we have to worry about cyber attacks, we can't use that software, we can't invest in that. But often there's safe ways to use those technologies. So just be careful. It is a scary thing, but make sure you're open and you bring the right people to the table before you just do a knee-jerk reaction of no, we can't do that in our agency.
Yeah.
Great closing thoughts, and thank you very much for that. Thank you all for participating today, for sharing your thoughts, your information with us. Please, as you go back, just give some thought to this. What is my role in this? How can we make a dent in this problem? When we go back, sitting on the plane, just give it some thought, and we'll all make a better and more secure healthcare and public health sector in the future. So thank you very much, and let's thank our panelists.